Hello and welcome to this podcast. And today you've got a wonderful opportunity to see two of the leading people in the field of learning disabilities in the UK, but actually also in the world. Coming to you on this podcast is Scott Watkin. Hi, Scott.
Hi, Jim. How are you?
I'm fine, thanks. And what is it that what's your background and what's your interest in learning disability fields? And then we'll move on to Yvonne first. So your experience and why are you involved?
So everybody, my name's Scott Watkin. I'm head of engagement at Seeability, and I make sure that people we support have a voice not only within the organisation but externally as well. And I've been involved in social care for the last 13 years, talking about different topics and issues which are all about making sure that families and people with learning disabilities all get their voice heard, but also having equality and being treated with equality and dignity and respect.
Excellent. Thank you very much, Scott. And before I tell you a bit more about what we're actually going to discuss today, I'm going to go over to Yvonne. And Yvonne, please tell us a bit about yourself and why you're here. This is Yvonne Newbold.
Hello, Jim. Lovely to join you and Scott today. I'm Yvonne Newbold. I'm basically, I've been involved in learning disability issues now for, 27 years. My son Toby had his 27th birthday on Friday. So, I could actually date it. Toby was born with a syndrome that is so rare. He's the only person in the world who has that particular syndrome. And he has profound and multiple learning disabilities. He's non-verbal. He's also great fun. He's got a huge personality and he lights up a room in a nanosecond. But basically, for his first 6-7 years, he was so ill that we nearly lost him several times, and most of that time was spent in hospitals. So as a mother, I've seen how easily things can go wrong in hospitals simply when staff don't always listen, and when they do listen, they don't always connect or really understand the implications of things. We have often lost him, not just because of his illness, but because of things going wrong in a hospital setting. We've had some very, very close calls. More recently, I was diagnosed with stage 4 cancer and given 2 years to live some years ago. I'm still here. But at that point, I knew that I wanted to do what I could for the rest of the time while I was here to try and make the lives of the next generation of children and young people like Toby better than it was for us. And as part of that work, I wrote a book, and I now support a community. I'm in touch with over 50,000 families in the UK of children with a learning disability and autism, but I'm particularly involved in children who, because of their diagnosis, are also violent. And I also sit at national level on policy and strategy boards, including I'm a member of the NHS Assembly, I'm involved in the LEADER programme, I'm involved in children and young people's transforming care, and lots of other things, including health inequalities. Sorry, that was a bit long, but
Wow.
that's
See,
me.
I told you, everyone, we've got two of the leading experts in the field here with us today. And I didn't say who I am. So I'm Jim Blair. I'm a learning disability nurse. And today we're going to be talking primarily about the change in the balance of power away from professionals directly to the families and people with learning disabilities themselves, because that's how it should be. But unfortunately, as you're going to hear from Scott and from Yvonne, that hasn't always been the case. But you know what? We've got solutions up our sleeves that we want to share with you about how we can change that, working together across and within health, education and social care. But it must be with people with a learning disability and with us, not for us, but with us. And that is what's really, really important. It's a massive change, I think, for many in system changes and services. They like to talk about co-production. We're talking about something going much deeper than co-production. Co-production is a bit like ITV working with BBC and then hanging out with Netflix or Disney Channel. But each one of those has different power strains, and each one has more money maybe than the other. And therefore, it isn't about actual equal co-production at all. What it is co-production, but it's co-production with one person has more power than the other. That's how I equate co-production. Scott, what do you think of that as a sort of idea about what co-production is? Does that ring true to you, or do you think co-production is always on equal footing?
So I think co-production can be interpreted and addressed in several different ways. As you're saying, that's one way. I think some people use the term co-production as working equally with another person, and having that balance of working together, but also co-production is not always done in a right way and can be seen as done in a very tokenistic way, in terms of one person might do lots of the stuff that the other person's responsible for doing. So actually co-production doesn't always happen in the right way. And so when we talk about that term co-production, for me, it is just about working together to achieve the goal that we want to achieve.
So it comes back to the idea of with us, doesn't it? Not for us, it's with us. It's the together that you rightly point out. And that's really the purpose of today's podcast as well. And we'll talk about some of the solutions going forward. Yvonne, for yourself, co-production, and you're on a massive amount of boards and different groups that you can influence. Do you ever feel that it is always co-produced and is all co-production? And how involved do you feel in that process?
I think it's getting better, and at the national level, I think there's a bit more understanding than there is at the sort of grassroots level about co-production. However, overall, I've had a lot of so-called co-production experiences where really what it means is we're the professionals, we want you to agree with us. And co-production means me ticking their box and saying, oh, yes, no, yes, sir, no, sir, 3 bags full, sir, you're absolutely right, sir, which is not co-production. It's also quite interesting because one of the things that I speak out about a lot in nearly all the strategy and policy builds that I'm on is the whole concept of the balance of power and how families so often get blamed simply because there's a lack of understanding. When people can't quite make sense of what's really going on, the easiest thing is to judge and to blame other people. And that is almost endemic throughout the health and care systems, unfortunately. Every time I bring this up, it feels as though it's hard to get that across to the other side of the table, to people who are on the professional side. It's minimised, or I'm told, oh, right, well, that's why we do this, to counter that. Nobody, unless you've actually been having the experiences that I and thousands of other people that I know have had, where families are blamed for their child's behaviour, where families are accused of fabricated and induced illness wrongfully, when there is so much fear and there's such a lack of equality of power in a relationship. Now, the thing is with co-production, it should start right at the very basic level of a clinician's appointment. I am Toby's mum. I am his expert in knowing, for instance, how we can approach things so that he is more likely to cooperate, say, with a blood test or an injection or sitting still for an X-ray. You might be the clinician. You're the expert in knowing what might be wrong with him and what tests he really will need. Now, if we can combine my expertise with your expertise, then who benefits? Toby 1,000 times over. We can really work together. But sadly, it sometimes feels as though clinicians feel threatened by my knowledge and by my assertiveness. And no matter how hard you try to work with people, it doesn't always happen at all.
Great. I'm sorry to hear that. And I think that rings true for many, many families. And certainly it's been my experience over, you know, the near 30 years I've been in learning disability fields, and about sort of 28 years of those, or 27 years of those as a learning disability nurse. And I think that the problem is that sometimes people feel that when people are trying to challenge and change things, that they say it's some sort of personal professional attack on them, whether they're a social care educator or healthcare professional. And actually what they really should be thinking about is, it's not about me. It's not about how I feel. It's about how we can change this with the person for them to have a good, healthy, happier future and their well-being. Now, we've touched a bit about co-production, and the reason for that, for those that are watching, is because the next bit is what we really want to talk about. And that is, as Yvonne said, the balance of power, the shift away from this sort of lots of lovely words about how we're going to do things to actually doing it, and doing it at a full level, in a real genuine sense of doing it, not just lip service, not chatting about it, not so that somebody could misunderstand what co-production is. Maybe I did at the beginning, maybe I didn't, maybe my understanding of co-production is correct, maybe Scott's is, maybe Yvonne's is. But what we really need to look at is, how can we stop confusion from reigning when we're actually looking at solutions? Now, Scott, you know, we've talked a lot about some of your experiences, and you were the co-national director for learning disabilities many years ago. I know that one of the recent occupants felt that they were the first national director, but that they weren't. What do you think about how things can really shift? And do you think that we need to have a post like yours, somebody with a learning disability, as a co-national director, and maybe another one should be another co-national director, a family, which I'm going to ask Yvonne about in a minute. But what do you think we should have in relation to the change that we need to see? How can that happen?
I believe that we've still gone back I think we've gone backwards in terms of policy. And as I was the co-national director back in 2009, it makes me think about that. I'm getting old, actually.
Well, you're a lot younger than me.
And me.
Yeah, we're just obviously very old now compared to you.
Well, you are, but I wouldn't say that.
Yeah.
But what I believe is that, actually, I said it then in the department, whilst I was in the Department of Health, that actually, if you remove this position of somebody being able to speak up and have the people with learning disabilities, their voices heard, you're not going to get the same impact as you were getting then. And I believe that we're still very much not listened to by national leaders, and by actually the I believe that they will talk to people as they feel necessary to talk to people, but actually they don't. What I suppose what I'm saying here is, I'm trying to put it diplomatically, but that's not going to work here. They'll say that they do it as they're ticking a box. So they'll say that they've consulted you, said, yeah, that's fine, yeah, we agree with all of that, but actually what you don't see is the change happening.
Yeah. So a bit of a nodding donkey approach, you think? I hear what you say. I understand what you say completely, but I'm not going to do anything about it, but I'm just going to smile nicely at you.
Yeah, and I suppose the other thing I want to add here is that actually when I was there, I was always making sure that I had contact with as many people with a learning disability and families as possible. And I always believed at that point was, well, why wasn't there a family co-national director either working in the department, because actually the families issues to the people with learning disability issues were similar, but actually some of those issues were different and needed and actually both of those national directors could have supported each other and could have challenged it in the way that it needed to be challenged.
Yeah, I think that's really helpful, Scott. And I think from your perspective as someone with a learning disability, but also having been the co-national director, and I think people need to remember that we had a time when there was somebody with a learning disability as a co-national director. We don't currently, but we should move back towards having that, but in a different way going forward. So Yvonne, the other part of that is there's 3 co-national directors that we're suggesting here, everyone. And the first would be someone with a learning disability. The second would be a parent, so someone like Yvonne, and the third would be somebody like myself, who's a health professional or similar, but with a long-term experience in learning disabilities. There already, for those that are listening, you can tell that it isn't tokenistic. It is that the balance of power will have shifted, because of 3 co-national directors, 2 are people with living experience of having a learning disability or having a child or a sibling relative with a learning disability. There already is a shift, because if you're looking at unity across the board, that sort of level of co-working demonstrates a significant shift that isn't currently available within our leadership model that exists in the United Kingdom. I'm going to hand back to Yvonne now and say, what do you think about what we've just talked about, and what would you think about, and what could the role of a co-national director that is a family member be in the future that we're trying to envisage?
Thanks, Jim. I think one of the problems with co-production is that it's often the clinicians that own the narrative, and they often come up with, say, a menu of possible choices. Now, that menu of possible choices, because it's come from just one part of the we have a triangle of people involved in making the right decisions. We have clinicians, we have somebody with a learning disability, and we have families. If only one of those corners of that triangle makes the decisions and comes up with a narrative, often all I've been offered are some pretty weak choices and some pretty weak ideas. I think that just by having 3 co-national directors, where somebody like myself could represent families, and somebody like Scott could represent people with a learning disability, as well as working with somebody like you who can represent the clinicians, that would give a very, very clear message to everyone working in health and care that families and people with a learning disability actually matter. We know what we're talking about, and that we should be included. But I think as well, we need to approach this, I think as well, with a lot of sensitivity and compassion. I think one of the problems that I face as a family member is that the clinicians that I interact with on Toby's behalf, they often are not supported properly. They often feel that everything is very data driven. The soft skills don't get counted. So it's all about the policies, the protocols, the procedures, rather than about the people. And they feel judged and watched often by their own teams and by their own management structure. They cannot pour from an empty cup. They do not always feel safe when I walk in with Toby, because they are not supported, they haven't had the training, they don't understand the life that Toby and I lead because of the differences that any type of disability automatically bring. We need to support the people on the front line too, with a lot of compassion and a lot of help them to understand, because I think that's where the judgment and the blame comes from, because they're trying so hard to protect their own back and to feel safe themselves. And if we had a system whereby the fingers don't get pointed, and if something goes wrong, everybody sits down and thinks, right, well, you're only human. What can we do better next time? How can we learn from this? But not that lessons are learned that we hear 1,000 times over and is just old pat nonsense, but that real lessons should be learned. You know, I think that the idea of having 3 joint directors representing each of those corners of the triangle would give a very, very clear message that we are all working together and that is the way forward. And I think it would still take a lot of time and a lot of unpicking, but I think that until we do that and really put our money where our mouth is, all that will happen is lip service. I've sat in meetings about Toby for 27 years. I've been involved in local and national policy, well, probably since Toby was about 2 or 3. I've sat in so many meetings, I've had so many promises, I've been told that lessons will be learned, I've been told things will change, and nothing ever happens.
Yeah, and I think that's the frustration, and I completely agree with both of you. You know, it needs to be supportive change for everybody. And I like your
something else, Jim.
Yeah.
What Yvonne's saying. So when we had this Walton Hall scandal after the Winterbourne View scandal, I sat up there in the Department of Health and Social Care in front of the Minister, Caroline Dinage, and I said, I can't keep sitting here telling you that actually abuse after abuse is happening to people with learning disabilities in assessment and treatment units. And you sit there and you say, I'm sorry, lessons are learned, and all you get is, and I can quote this from the Minister, I'm sure she won't care because she's not doing that job anymore, but she goes, well, I really get it, Scott, I really don't want you to stand down out of your role as co-chair. I really think that we need to make the changes happen so the abuse doesn't happen anymore. Well, have we seen anything in terms of, has anything really changed? The answer I would say is no, it hasn't changed. It's just people sitting around a table and talking about it. And what we actually need is these people who sit behind their desks to actually say, to come out from behind their desk and actually see what's happening for themselves and going, no, this is not acceptable.
Yes, I completely agree, Scott. And I think this is why this for those that are tuning in today, this is really important, because what we're talking about is learning disabilities, changing care, healthier futures. And at the heart of that, it must be those with learning disabilities and their families. So we talked a bit about a panel, a quality improvement panel. Both Scott and Yvonne have been talking about quality and how do we improve both that for the person, but also for the systems and change. Well, if we had a quality improvement panel to hold the code directors to account, as well as the government and others, then that would be a massive change and would lead, like Scott said in his discussions with ministers, it would lead them to actually have learned lessons and to make the change real. And this panel should be made up of 51% people with a learning disability, 34% family members, 15% professionals. That panel demonstrates real change, real focused intent to make things different for always. So if you think about it, you've got, let's say 10 people on the panel, don't know, not suggesting numbers, but just look at the 10 here. So you've got 5 people with a learning disability, 3 family members, 2 professionals. That's the change in the balance of power that isn't optional. It isn't something that's a nice thing to do. If we are serious in these times, we're still in the COVID days, but post-COVID into the future, if we're really serious about addressing the early deaths of people with learning disabilities, the poor care, poor experiences, and poor outcomes that they have across health, social, and educational care services and settings and life, this is what we have got to do. It isn't really an option not to do it, other than we'll just get what we're getting now, which arguably isn't as good as it could be, which we already know it isn't. So what would this panel be doing? And before I bring Yvonne and Scott back in, the panel would be planning, developing, training, monitoring, improving quality and insurance of health and well-being for people with learning disabilities in this country. Now, that is powerful. Why is that a significant change? Because you're involving the right people in the right way at the right time, but you're also enabling people not to have any tokenism here at all, because with the right to be involved comes the accountability, the responsibility, and then the drive for real change. Because without that, and without that commitment and responsibility, it can often just become a bit of a tick box, as Scott talked about. And what we really need to see is that there's ideas approach is embedded within the panel. And this approach is about health and well-being. An approach within the panel and how it would change things is the I stands for information gathering. So trawling around, finding out people's ideas up and down the country, celebrating, showcasing great ideas and practices and trying to replicate those and really, really doing that. The D is decisions and design. What decisions need to be made about the designs and the information that we've come forward and what has been uncovered, what is good, what isn't good, what works, what doesn't work, how can it be improved, and engage. Engage and involve people all the time throughout the process. So they're really, truly involved at a local level, then through the panel, and then into the people who will be facing the panel, and that will be the co-national directors, and then going through up to government and decision makers. And then there needs to be action. There's got to be action. No gas show roaming now, any more hot air words, all of this sort of stuff, like Scott was talking about experiences he had over 10 years ago where people said, I've really got it. We're really listening. Ministers said that then. They say that now. Are they really listening is the question, because where's all of the action that is so readily talked about and the lessons being learned? Solutions also must come out of this group. It must be focused with clear outcomes and achievable outcomes that make demonstrable change for and with people. So what kind of actions does this group really need to be addressing? It needs to be looking at quality of treatments across education, health and social care, addressing the broader causes of poor health and well-being, inadequate support, poor housing and poverty. Now, those are the broad aspects. Obviously, there'd be action plans and things that would be brought forward and key targets and others that need to change and shift. And we've just talked about some of those. But this could be the defining future for and with people with learning disabilities and their families. Yvonne, what do you think about that as an idea? I'm going to bring Scott in a bit, but Scott and I have created it together. So it'd be great to hear what your thoughts are about such a panel.
It basically sounds great. It really does. And what I think the strength of a panel with more representation from people with a learning disability and their families would be able to achieve is that we would be listened to. if I was to talk, say, about the huge issue of parent blame in that sort of meeting, there would only be two professionals. They couldn't shout me down because other people around the table would have been there. They would have experienced it. They would have understood the authenticity with which I'm speaking, and they would understand that these are the big problems. Often, families and people with a learning disability raise issues that are huge and key to them, but because they don't quite resonate with the people who are the supposed experts, the clinicians themselves, the professionals, um, they're just dismissed as being inconsequential or difficult. Now, if I'm the only person or only one of two or three on a huge body where most people are professionals, the balance of power is such that it's going to be much, much harder for me to get across the things that are really happening, the things that are barriers, the things that are stopping people with a learning disability becoming. It's not just about getting treatment, it's also about valuing them as human beings on an equal basis to everybody else. Because, you know, the human race, we're a hodgepodge, we're all a bit different, we're all a bit, you know, everybody has a value simply because they are a human being, they're part of our tribe. Basically, when the ratio is such that there might be just two or three family members or somebody with a learning disability and 10 or 12 people who are professionals, it's almost impossible to really truly get across what's really going on in a way that there's always a disconnect in the communication. People can only really ever take on board what they understand. And most people can only understand things that they've lived through or experienced themselves. And that means that an awful lot of clinicians and professionals simply can't really relate to the big issues that families like mine and like Scott's face several times a day on a daily basis. And until we actually get proper representation so that families like Scott's and like mine can actually explain what the difficulties really are, how it holds us and our family members back, and what the solutions might be, we're not going to get any progress. It's basically the wrong people are making the decisions from a place of very good intent and very good heart, but not always from a place of experience and the understanding that can only come with that level of lived experience.
Excellent, thank you, Yvonne, and I'm pleased that you, like Scott and I, are so passionate about this model of change, because I think it really is the future. And I think summary there is that the option of having a panel and the co-national directors is a very good one. It's a good steer towards success, because it'll be the right people in the right place in the right time and the right numbers, rather than the reverse that often happens far too frequently currently. So Scott, you know, why is it that you're so passionate about this model that we've been talking about for the many years that we've known each other? You know, why is it something that we've been thrown around for so long amongst ourselves, and now we put it onto the national stage? Why is it so important, do you think?
So for me, it's about, I don't think we have the leadership which is lacking, and the culture which is lacking up in the center of everything that we do. It's always that we at the moment, I believe we have a model which is a dictatorship model, where they will talk to you when they want you involved, but if they but actually the deal's already been done. is what I'm saying. So sometimes it's very much lack of consultation, and they're doing and they can get away with doing it like that because they're saying that, oh yes, I've consulted that person, I've spoken to that person, but actually it's very poor and it's very lacking, so they can just tick their box. So what they need to be doing is actually thinking outside of the box. And I remember a meeting I was on with NHS England colleagues, and I think Yvonne was on that meeting as well. And we raised the issue around co-production, and we raised the issue around actually when you appoint the next Ray James, are you going to make sure, is a person with a learning disability going to be working alongside them? And the answer was, well, we haven't thought about that. We're not sure if it's really necessary. So I did jump in at that point, and I actually said, actually, the value of having people with learning disabilities in a leadership role is they can support and make the and support and make the influence to help get the case across, to make sure that people have their voice heard truly and honestly. But but people don't seem to want to do that, and that's an issue for me. They want to have people with learning disabilities and in teams to say, oh yeah, we recognise that we're working with people with learning disabilities. Now, if that was my role at Seeability, and my role's no way like that, my role is about speaking up and making sure that we have good and integral leadership within the organisation, and I have the power to challenge and as well, and that's right, and that's what my role is about. But I've got to be honest, in the centre of everything that we do is we don't have that leadership. It's very much lacking, and actually I think that it's now time for a change, and the tables are turning. And we need to see change. We need to see more people with a learning disability and families in a leadership role and not left to the bottom of the pile. So this model that we've been working on is a fantastic model. It's a great model. It's a solution to be able to develop it even further, I believe.
Yeah. Great, and I completely agree, and I think people listening in will be very surprised that I agree with you both there entirely, I guess. But I think that the reality for me is it's not optional. At the moment, we're in the UK selecting it as optional to involve people or not involve them. Yeah. We dress up lots of different phrases about what that looks like, how it looks like. Let's just banish all of those and work with this, because this, if you go back to the concept of the model and the panel, made up of 5 out of 10 people in that panel would be people with a learning disability. 3 out of 10 would be those family members and siblings. And then the 2 remaining seats in that, on that table, if you like, would be professionals. There already is a shift in the balance of power. That already, for those listening, equates and addresses a lot of the things that Yvonne was talking about, the feeling of the lack of balance of power, being outnumbered. And I think Scott said that as well. But also, it's sad to hear that Scott had that experience recently in NHS England, where they hadn't even thought about having another co-national director for learning disabilities, let alone a co-family member. I'm going to pass over. I'm going to finish up my talk now. So it's been great listening to you all, hearing both Yvonne and Scott. We're going to have last points from Yvonne, and then Scott is going to be the last person to speak. So over to Yvonne, but I'm not going to speak anymore. I'm handing over to Yvonne.
Thanks, Jim. Just one very quick little point. Scott, you said something that got me thinking. You were talking about professionals, and you were saying how professionals talk to us. Now, I think maybe we need to change the vocabulary and change the narrative, because we don't want to be talked to. Being talked to is very similar to being talked at. Wouldn't it be great if in a year or two's time we could do this again, and instead of saying the professionals said that they talked to us, wouldn't it be great if we were able to say the professionals said they listened to us? That's huge. And I think that basically is what we need. We need to be heard. We knew by professor want to get this right rather than us and us teacher. So yeah, thank you.
How you can, I believe it's how we change and we influence people to make them say it's a us and us model working together, and not doing it for us. I think that's really, really important. And I think the pandemic over the last 12 months has really seen how it is, how people can have total control and issue guidance and stuff without easy read information coming out and it all being late and last minute. And so people with learning disabilities don't get the accessible information that they need, and that's just simply wrong in itself. So I think it would be great to get to a place where we're not just ticking a box, we're going above and beyond to tick, think outside of the box all the time. And professionals, government, NHS England are all doing that too. But currently they're not doing that, they're just ticking a box. So thank you very much for inviting me to come along and talk to you both, Jim and Yvonne. I've really enjoyed it.
Thank you.
Thank you.